Doctors and nurses of Reddit, what is the worst thing you have seen a patient go through and survive? I saw a woman who had been stabbed in the neck with her own high-heeled shoe. Somehow, she just needed stitches and a tiny surgery. Okay, I was on call for transplant as a coordinator, and we got an organ donor who was a 30-something-year-old Shrek's worker who was beaten up and left for dead in an alleyway. They were non-responsive with very little brain activity, not to mention the physical injuries requiring life support. But, because they had brain activity, they were what we call a DCD donor after cardiac death, and we wait to see if they wake up or become completely brain dead. Well, they woke up. Then they sat up and started trying to take off all the equipment. Their heart started beating on its own again. They walked out of the hospital 2 days later. This is deliberately vague to protect anonymity. Not a doc or nurse, but when I had my first spontaneous pneumothorax, on the bed in front of me was a guy with his head swollen 3 times the size of a normal head. Days later, when he woke up, not like unconscious wake up, but like can't open his eyes and speak, he changes the tire on his Audi A4 Combi. When the tire was taken down and the car on the jack, he remembered a screw which made a sound every time he turned the car to the left. So he hops under the car, turns the screw, and hears a squeaking sound from the direction of the jack. He turned to it and saw the jack turn to the side while the car fell. The Audi A4 Combi fell from circa 55 centimeters in his face. His collarbone saved his life. The car was laying in his face for about 4 hours until his grandfather came to get a drill. He lifted the car with his hands long enough to pull him out. His eye was the reddest I've ever seen. The back of his head was just crunched. He had multiple brain surgeries and had to relearn a lot of movements, especially eating, since they were forced to partially reconstruct his jaw on one side. I kept holding contact. He is now in his 30s, and with therapy he lives a good life as farmer, 3 kids, and happily married. Nurse here. It was in the 80s. I was working in ER and a man came in. I still remember his name, with his coat on and his arms folded in front of himself. I was talking to the check-in clerk and asked the man what brought him to ER. He opened his coat and his intestines started slipping out. He quickly caught them, stuffed them back in, and held it shut with his coat. I remember asking him what time this happened. It happened about an hour prior to when he came in. I asked about the delay. Well, it was pot roast night and nobody in the world made better pot roast than his wife, and if he was going to die, he wanted to choose his final meal. He ended up being fine. EMT here, severe electrocution. Yes, that's what it's called, even if they don't die. He was working on a roof and a piece of gutter he was holding bumped a high voltage line that was supposed to be off. The hand holding the gutter was completely degloved, as were several spots on his torso. His whole body was covered in 2nd and 3rd degree burns. Somehow he was not only alive, but conscious, but his airway was burned and swelling shut. Fortunately, the paramedic I was partnered with was an ace at intubation and got a tube placed in time, and we got him to burn unit quickly. Last I heard, he survived. Patient had history of multiple suicide attempts and self-harming. He drank caustic cleaning chemicals and damaged his ability to speak and swallow. He had problems communicating and had a G-tube for nutrition. He had a urine bag because he had damaged his urethra and bladder with knitting needles and installation of chemicals. He was severely scarred over his whole body after attempting to immolate himself with gasoline, which also left him with several amputations. He was in the VA system, and I knew him over the course of many years. It was always distressing to interact with him. I couldn't satisfy his neediness, which he constantly demanded that I do. I'm a rescue flight mechanic in the Coast Guard H-60 helicopter. We rescued a 9-year-old boy who went through a large vessel's prop. He had a laceration across the interior of his back that exposed his vertebrae in both body cavities. His left thigh had 2 large lacerations. His right arm had several large lacerations. His left ankle was cut in half and twisted off to the side. After flying him from the Bahamas to Miami, we dropped him off at Jackson Memorial. 2 days later, the hospital informed us he had survived. He was given over 3,000 stitches and multiple transfusions. His vertebrae was chipped, but his spinal cord was not cut. kid was damn lucky to live. NICU nurse here. Baby was born with an undiagnosed congenital heart defect. A defect that if not treated will lead to death. Baby was discharged home. Mom took the baby to the pedi the next day because she felt like something was wrong. Pedi blew her off and said they'd follow up in a week. The next day baby came into the NICU basically DOA. There was duct in the heart that had kept her alive her first days, but the second day the duct closed and her little body went into shock. All babies have this duct that closes after a few days, and if their heart is healthy all is well. But some defects need the duct to stay open to stay alive. Her defect was lethal without a patent duct. I walked into the room that morning. The room was trashed. Baby swollen, not even looking like a baby, with every drug imaginable being pumped into her body. You could barely even see there was a baby with all the machines hooked up to her keeping her alive. Her little body in shock, nearly shut down, bleeding from every hole in her body. She was sick for a very long time and doctors told Mom she would never walk or talk or live a normal life. Well, this little baby is 3 years old now and visited me yesterday. She's beautiful, living a full life, walking and talking with only a scar on her chest as a reminder of her first few months of life. The scar is a reminder that her heart is now perfect. Ex-nurse here. This was one of the ones I've seen in training. Definitely not the worst, but one of the more cringe and pain thinking about it ones. Poor lad. Around 23 if memory serves, showed up in our ER with a work accident. He was using an angle grinder when the disc flew off and grazed him in the thigh and scrotum, shaving off small bit of it, leaving his right testicle hanging out. Definitely not something you ever want to see. He was a good sport about it though once he got after the shock of seeing his own testicle, nudging his friends and asking, "Hey, you want to see my nut?" and flashing it. It was sutured up and the damage was superficial and the testicle itself was unharmed. When I was in medical school, there was a patient in the emergency department with severe traumatic injuries to her face and what appeared to be defensive injuries on her arms. She didn't speak much English and was with an older man who claimed to be her boyfriend. She wasn't a patient assigned to me, but I was aware that the city I went to medical school in was a hub for human trafficking, so I brought my suspicion to the attention to the attending ER doctor, who managed to get the two of them separated and the patient connected to the social worker. The man ended up fleeing the ER and the patient ended up talking to a social worker and said that she was forced to work for that man and others after her passport was taken from her on arrival to the US. Her injuries were not life-threatening on their own, but they were pretty severe, and I think that, had she stayed in the situation she was in, there was a strong chance that she may not have survived. Definitely a scary situation, and I'm glad I said something, since I'm normally pretty introverted and was a little worried that I was just speculating. Hi, doctor here. I saw an NYPD officer years after his accident, but he was shot in his Kevlar vest, which fragmented the bullet and ricocheted up through his cheek, traveled through his eye, exited the eye into the orbital bone sinus and exploded off a part of his skull with brain matter. This disfigured man, even after reconstructive surgery, had a large hunk of cheek and skull missing, a plate in his temple. The most shocking part of his examination was that he was completely healthy, just disfigured, cognitively normal. Vision was legitimately 20/20, and only some tiny bits of peripheral vision lost. Looking into his eye, you could see the entry wound of the bullet fragment, the trail through the vitreous gel, which lead directly to the exit wound. This thing must have been red hot, because it cauterized the wounds going in and exiting. It was bananas, and still 25 years later, one of the most insane cases of survived trauma I have ever seen. Not a nurse, but a patient. I was a gunshot victim at 9 years old. 6 bullets, shattered elbow that now have 32 pins and screws holding my upper and lower arm together. Permanent nerve damage in my leg, and am unable to feel or move my foot, all along with losing my mother at the scene of the crime. I vividly remember identifying the perpetrator out of a mock lineup in pictures while in ICU. My EMT friend had a girlfriend who, when they were 17, broke up and she blew her face off with a shotgun. He said he came to see her in the hospital afterwards, and everything below her eyes was just a bloody whole mess. Her grandfather told her she should have finished the job. Another guy I know had a gas jug in his car. He and his 12-year-old daughter pulled up to the pump and she went in to get some snacks. He lit a cigarette and blew himself up. Had third-degree burns on most of his body, but lived, at least for a while after it happened. I didn't see him or hear about him after we tried to raise as much money as we could for him, so he might have eventually succumbed. In the middle of the night while doing my rounds, I walk into one of my patients' rooms and I see this liquid on the floor. So I turn on the lights. Turns out that liquid is blood. Apparently this woman had pulled out her femoral catheter and started bleeding out. She was laying on a plastic air mattress, so the blood didn't get soaked into the mattress and it instead dripped onto the floor. I rushed in and applied a tourniquet and dialed 911. Had I been 5 to 10 minutes late, this person would have easily bled out. They ended up making a full recovery. Obligatory, not an MD or RN, but I work in psychiatric units and saw an older lady who tried to kill herself by slitting her own throat and failed. So now she just has a huge scar across her neck for the rest of her life. Not the worst I've seen by far, but the one that stuck with me the most. Poor lady. My mom used to be an X-ray tech in the ER. They once had a patient who attempted suicide by drinking lye and lived. Not a nurse or doctor, but instead ER administration. I go from room to room making sure patient charts are up to date. Insurance, mailing address, primary care doctor, etc. All the sexual assaults that came through our ER. Even though no one wanted to talk to me as a male and as someone who's not a nurse or a cop. But the stories they tell my coworkers, always a female on my shift, were terrifying, and honestly the fact that people will blame the victims like they wanted this to happen, makes me shake my head in shame.